Issue number 2 for me is healthcare, and that's a really big subject. It seems to me a federally funded preventative medicine education program would be a good place to start. Physician, heal thyself, I always say. I've spent a lot of time around sick people in the course of many of my jobs, and it seems to me these days most of them take no accountability for their illnesses whatsoever. It's as if disease suddenly sprang on them from out of nowhere through no poor lifestyle choices of their own, which is more often than not the case. And now they dump the whole thing in the hands of the medical establishment to fix, as if it's their problem alone. It's not hard to understand, given the accountability lack across the board these days, but I mean, come on, we are all accountable to the law of cause and effect, after all. Of course, these misconceptions are fueled and facilitated by the medical establishment, since it seems to all come down to getting while the getting is good, and there's a heck of a lot more dollars to be made off pill-popping, perpetually conditioned sick people than educated, accountable well ones. Simply put, beyond that, we are the only nation on the face of the planet, the only industrialized nation, without a national health care plan. And for that, Americans should be ashamed. Not that toxic shame that leads to more illness, but that healthy shame that tells us that we've fallen short of the goal somehow. Having lived in other countries, where every man, woman, and child citizen of the country had access to health care without regard to socioeconomic status, and seen it in action, to me, the present state of American medicine and its payment method up front, or you can lay on the floor of the emergency room and bleed to death way of doing business, is just plain uncivilized.